The first thing I really want to say before I do anything else is to say that it shouldn't be me speaking about this, it should be my colleague Nigel, who really sadly is not very well today and can't be here, but he has been the driving force behind this whole thing. And absolutely the credit goes to him for that, so I am just here to speak on his behalf. So I'm Amy, I work for Notts Healthcare, I'm in the patient experience team. I've got Michael here with me, who is a service user volunteer who's supporting this work, and also Kath, who works at Rampton Hospital as a mental health nurse. Is that right? Yep. Just make sure I get the right title. And we just want to talk to you about what we've done in our high secure, particularly our high secure, but also our other secure mental health services, around how we genuinely listen to people and about how we then involve them in what we do with their feedback and how their feedback has an influence on our services. We were runners-up in the PEN Awards for this, and we're not in any way bitter about it. I mean, we pocketed all the biscuits off our table as compensation, but no, we're not bitter at all, because I would really recommend you see page 65 on the brochure in your booklet. They're the ones that won Serco, and they are doing an absolutely amazing project as well, so I just want to get that out to say we would have loved to have won, but we lost out deservingly to Serco for their project as well. I think they're speaking later. So, what did we do? Let's move on to this one. So this is just a recap. We're going to focus the 15 minutes that we've got on the 5 things that, well, maybe the 6 things that we learned from doing this work, rather than to give you lots and lots of detail about what we did. If you do want to look at what we did, I think we're on page 56 in the brochure, but we don't want to give you loads and loads of detail because that's probably not as interesting as what we learned. But as a quick recap, what we did was we started off with a really genuine interest in hearing the experiences of people in our services, and it's fair to say, as Louise said, that our service is reasonably tricky. So we're working with a lot of people who don't want to be in our services. We're working with a lot of people who are incredibly poorly, very vulnerable, perhaps not able necessarily to articulate very well how they feel or what they think about our services. It's also fair to say that a lot of people have got a bit of a kind of mistrust, partly because of the nature of their conditions, but also because they're in a high secure service and there's power dynamics at play. So it's important to say that we did really start off with just that genuine interest in what is it like to be in our services, and we really wanted to come at it from a don't assume you know what it feels like to be in those services. It's as I said, it's very tricky. So we started there, and I think that's one of the real strengths of our organisation, that we are very relationship based, and we do like to genuinely like to listen to people. But we started off with a reasonably ineffective closed patients meetings really across these services, and a survey. Our survey's okay, it doesn't ask lots of questions, it's mainly based on free text, but that's really all we had when we started. What we've done since is that we have started to use care opinion far more in our high secure services, but obviously they don't have access to the internet where they are, so our volunteers are a really key part of that, and Michael will come on to that in a little while. But we've got probably between 20 and 30 regular volunteers that go into our high secure services, this being a service that prior to this work was considered far too risky for volunteers to be going in, but we've managed that and they are absolutely established in the service now, and as I said, Michael will tell you more. We also did a lot of work around training the patients in there to be really good representatives for their wards. So we have patient volunteers that represent their wards in their forums, in our patient councils, so that they can bring up the feedback from their ward and so they can represent it, and also hold the services to account, particularly the senior staff, around if nothing's being done in relation to the feedback, what is going to be done. We also did some really innovative stuff. So, as has been said on our table, we think, somebody's going to correct me at some point on this, we think we were the first NHS organisation to publish all of our feedback verbatim, absolutely as it's said, within the month that it's been given to us. So that's all on our website, our devoted feedback website called Your Feedback Matters, and you can find it, it comes up as your first link on Google, I think. So we did that, and that includes stories from this group of people who, as I said, are at a particular point in their care and are at a particular point in their health, so that's pretty innovative. We also did things like our volunteers went in and took feedback through the seclusion, the gap in the door in seclusion, from patients who were really, really poorly. And again, that harks back to the fact that we had a genuine interest in listening. Just because somebody's in seclusion doesn't mean they don't have something really valuable to say about our services. So it's great that we did that, and that certainly was a new thing. We also were the first NHS organisation to post stories and feedback from patients in secure forensic services on care opinion, and we feel that this process could be replicated in any inpatient services, and it's certainly been replicated in our other forensic services. In terms of the impact of this work, the impact isn't, I'm afraid, in nice posters and shiny apps and things that we can show you on the screen. The impact is really in relationships. So I can really genuinely and wholeheartedly say that the relationship we've got with our patients in Rampton is far more equal. They hold us to account, they hold the senior managers to account, they are not shy in saying what they want and what they think needs to be done. If we don't act on feedback quickly enough, they damn well tell us, and rightly so, and that is put all through our board reports, right up and down through senior management. So we have a great relationship with them, and that has come about through showing our interest in listening to them and having that persistent attitude. So we're going to just concentrate on the 5 things that we've learned from this work. And I'm going to start here, which is to say that we needed to find a champion. So we're not keen on the stick, we're much more keen on the carrot. So we tend to try and find those people who arrive at this work with a natural aptitude or a natural good attitude towards it, and we work with them, and they soon show up the people that are not doing the same. And what was really important for us is to understand that for each of our champions, what is it that they uniquely brought to us, so that we ask the right thing from them. So this is a response on care opinion from Peter Wright, who's our Executive Director for Forensic Services. And one of the things we asked of him really early on was, yes, we could have you at meetings, yes, we could ask you to do a whole range of things, but actually if you were to respond to postings on care opinion, you would show our services that that was important and that they needed to do the same. If you showed an attitude in those responses which was open and honest about when we don't get things right, honest about when we can't change things, that would set the tone for our services. So he does that, and he responds to most, not all, but most of the postings that go up. For an executive director, I think that's reasonably unheard of. We get a lot of postings through on care opinion, and he reads them all and he responds to them pretty much in the same day they've been published. And it absolutely has the impact that we want. Our services know he's listening, they know he's going to jump in and respond if they don't respond soon enough, and it's really helped to raise the quality of the responses. So we've asked early on what they need to do, but what I don't want to do is give you the impression that all of our champions are at that level of hierarchy. Kath is one of our biggest champions in this work. Kath, there's nothing Kath can't do in Rampton, to be honest. If you want something doing, you go to Kath, and Kath makes it happen somehow. And early on we found her, Nigel found her, and we've been really grateful, and that's why she had to be up here today. She'll tell you more later. Our volunteers are every bit important to this as anybody else. So they are so incredibly generous with their time and their skills, and they go in and they talk to people who are very poorly, who might at first not want to speak to them, who maybe don't naturally have something to say or are unsure, and they work in such a sensitive and caring and compassionate way to just draw out as much feedback as they can from people. They also spread that message that we are listening, so volunteers, as Michael will say, are involved in the whole process, so they know when we're listening to feedback and they know when we're not, and they can give patients that message which builds that confidence. So I would certainly say find the champions early on and make sure that you ask the right things of them. This is another of our champions, just to quickly say, this is the head of clinical operations, Adele, and like Kath, she's a real gets things done kind of a person. This was what she said in the submission for the PEN Award. We have to be brave and transparent and expose the situation where things are not right in our services. We'll do whatever we can to work with patients to make things better. And when there are things we can't change, I expect staff to give honest answers, not to give false hope or to shy away from a problem. This was borne out when we had an issue in our learning disability services around bullying between patients. And instead of shying away from that and wanting to cover it up, she sent a load of our volunteers and our staff in with questions and with care opinion postings. She asked them to ask that specific question: have you ever experienced bullying? What was it like? How could we help you? And all of those postings went up on care opinion and she responded to every single one. So she absolutely lives by this, and we're really proud of that. And again, it gives the message to everybody else. And now I'm going to hand it to Kath.
Thanks, Amy. Okay. So, my name's Kath, and I've been a nurse at Rampton for over 30 years. I'm not very good at this, so I'm just going to read on what I've got here. So, it takes a lot for our patients at Rampton, as you can imagine, to trust anybody. And with the help of the Rosewood volunteers that we have, we are able now to go around the wards, collecting information for care opinion, for the SUS, which is the service user carer experience feedback, and then we build that and we work on that. But anyway, To build trust by showing what we're changing, and this is gained by the champions in Rampton Hospital and our volunteer service user volunteers. Once we've managed to get patients involved in surveys and sharing their experience, we have to then build on that trust they have given us. We found that giving and displaying feedback for us is the most effective way to show that their input is invaluable to the way we progress within the future care of everyone. We display feedback on a large notice board on the entrance of our building. So I work mainly in women's services, and we have a department called the Diamond Resource Centre. And as you go through the door, I've got big display cabinets, and I've got bubbles, the speech bubbles. And in each speech bubble is the question each patient has asked. And in another speech bubble, we've got the answers from Adele Fox, myself, Amy, Nigel, the volunteers, Peter Wright. So it's all there for the patients to see. So we display feedback on a large notice board on the entrance to our building, so patients have a visual display to see, and also we do have a large scrapbook for them to look at, full of older reports, so I don't throw anything away. So all the new postings go up in the display cabinet, all the older ones come out and they go into a scrapbook. We also display photos of events around the Diamond Resource Centre to show what has happened as a result of the patient's involvement and also the Rosewood volunteers involvement. It's not just my service, which is the women's service, that's involved in this. We also have Southwell, which is also a centre building for the mental health and learning disabilities, and we also have the Central Resource Building, which displays their care opinions and feedback, and that is for the personality disorders.
So that's your...
Oh yes, and this,
Yeah, go for it. Yeah.
okay, so this is what is generated. This is an action plan from the SUS that we collect twice a year from our patients. All the information goes to a central, and then it comes back to our modern matrons of that service. So this is the women's service SUS report, and this is discussed at our patient forums, which is held once a month. Sorry, I'm not very good at this. So, things that are worth doing don't usually happen quickly or easily. We changed our culture, but it required perseverance and energy. So, as you can imagine, again, our patients in Rampton, they don't trust a lot of people. A lot of them are very poorly, very paranoid, and they don't know sometimes where the information's going. However, with champions like myself and the Rosewood service user volunteers, they come in, they are well known in Rampton now to our patients, and our patients trust them as they trust the likes of me, being one of the champions. The enthusiasm and energy of the staff have shown in everything that Amy and I have spoke about, and I'm going to pass on to Michael.
Thank you. Yes, Michael, services volunteer. I've been involved in volunteering at Rampton and in Medium Secure as well for the last 2.5 years. I came on in a bit before that because I had to be trained up, and I'll go into that a little bit more. I think the first statement is important. We're able to build long-term rapport and trust with patients. And it's this trust and rapport that means we capture the richest, most honest and intimate feedback. It's not easily won. Traditionally, high secure hospitals were considered too risky to... Traditionally, high secure hospitals were, as I think has been mentioned, were considered a bit too risky for us to go in and speak and chat and get to know the patients. In the early days, I believe, it was under Mike Cook, when he was the chief executive, and with people like Nigel, who, as we hear, is not here today, they developed this sort of format. They decided they would get in there, they would train people up. Gently, catchy monkey. They had to start gently, slowly. Few people, very few initially, were trained up and were able to be escorted through and go along to some social events, to patient forums, and just get to know the patients a little bit, be accepted, not force themselves on them at all. But sometimes they've got something pertinent to say. Join in, say it. But what I've found is that what we want to do is in fact champion the causes of the patients. We actually want to be their voice. The idea is that they're not forgotten, that there are lots of people out there who do want them to get better, and we are right there at the front of that. So we were recruited, trained, skilled up, and so nowadays we establish as advocates and champions of the patient voice. Why and how can we make a big difference in getting feedback and opinion from these patients? That's the next question. Well, I think it's for a number of reasons. First of all, because we have time. We have time that staff frequently don't have. We're very fortunate that people like Kath and other champions within the system are very much trusted as well, and they actually introduce us and they ease our way in. They're very, very much part of this whole process. But once we're in there and we start to be known, it's nice to be called Michael by people who haven't seen me for a month or two. And then I go along to a social event, oh, hi, Michael. Didn't even have to ask my name that time. Something's going right, I suppose, unless I'm doing something wrong. We're peers. We struggle with some of the same mental issues that they have. And so, of course, we can relate to some of this. We don't pretend we understand it all, but we listen. We build up that rapport over time and the trust, which you've heard so much about. As I say, we went to social events, patient forums. We go along to the bigger ones like Oscars. I've done the mental health Oscars this year. I went up to Watford recently. I've got the learning disability and the women's Oscars coming up. It seems to be a mad rush sometimes. But we go along, we support, and we congratulate. To some extent, we're independent as well. We can't say what we want. We've got to be, there are certain things, but we can listen. We're not defensive about the organisation, about the trust. So they've got something to complain. Fine. Complain away. Tell us what you think. So when we're collecting this information, in this feedback and so on, they feel we're not judging them. They say it as it is. That's how they feel it, and I really do try and push that point myself. Don't hold back. This is anonymous. From this, something good should happen. As we say, the loop has to be completed with all feedback. And there are times when people say, well, what's the point? Nothing changes. And we have to convince them through giving that return feedback that things are changing. If we, having listened, we see that things aren't changing, things aren't happening, maybe there's an elephant in the room that we recognise, then we start to agitate ourselves. We ask questions. We are, if you like, suddenly their champions, their voice outside that secure place. We're trained in taking the feedback, in listening, and we know where the feedback goes. It's quite difficult sometimes when you get someone who actually is almost saying nothing. I was doing a care review not so long ago on one of the mental health boards, and this gentleman would say yes and no. Now, how can I ask questions that aren't leading? And I had to work around giving lots of alternatives, but I did my best to do so. And I think we got some useful information back from him. I'm pleased to say he's still alive, well, and enjoying attending there 3 times a week meetings on the ward. That's a particularly active ward. Right. We get involved in the analysis with patients at Arnold Lodge and sometimes elsewhere in secure services. I've been involved with the groups of patients who've got the main information that's come out of these reports, these SUS surveys, and then we've actually started talking around it. We've tried to come up with solutions. One of the things, for example, they're always concerned about is being left behind with the technology. What can we do to improve that? Can there be courses either by the education department or recovery college laid on for them? You know, what barriers are there to it? No, they haven't got access to the internet. I know I'm running out of time. But this is tremendously important because they see that they are shaping the future and they are bringing about that change. Move on, sorry.
No, that's good. I'm just absolutely going to do this one, which is just to say all of this work has been taken to other services. We didn't wait until it was perfect to share it. We shared it as soon as it started working. We shared it as soon as we saw something working. The volunteers is the most important thing that we just started to share with everybody. None of this is rocket science, it's really simple, but it's all been relationship based, as you can hear, and it's massively increased the amount of feedback we've got. It hasn't been anything complicated, it's just been about getting people to trust us and want to speak to us, and that's all we've done. So we've shared it, and I'm just going to pass over to Michael just to finish up.
So it's very important, I think, when we're doing it, to have a light touch. The feedback, getting it mustn't be a burden for those patients. They get a chance to express their concerns and feelings and show some appreciation. It's also important that they know it's not pointless, that it will be recorded anonymously and help to make up a bigger picture, leading to change. As you've heard, we also access those people who are not normally available in long-term segregation and in seclusion through those hatches in the doors. So we try and make sure that we're getting a cross-section. We can't get to everyone, but as many as possible. It's so easy to assume we know how people feel, what it's like for them and what they're saying, asked. But it's also not necessarily right what we assume, is it? It's so easy to assume people ask the world, give them the chance. Actually, they don't. It's small things. Things that make their daily life that much smoother running, that much more pleasant. It's so easy to encourage people to give feedback, but then not truly listen or act on it. And this is where we feel that we jump in and say, come on, what's happening about this? And occasionally, things have to get escalated, and we go along to some meetings where just that happens. Last quote there, take the less trodden path. It's much more fun and takes you to a much more interesting place. The patients we talk to may not be well. At various stages of their recovery and are sometimes a little confused, but they're not daft. They have very valid things to say and make astute observations about how things could be better. Give them a voice and you will find out much more about your service. Thank you.